Hey guys, welcome back to my channel. So today we are going to talk about a very simple but very informative test, and that is 6-minute walk test. Now let's understand what is this test, and then we'll understand how to do it and why do we need to do it. So what are the benefits and all that we can get after doing this test. So here we need 100 feet halfway for performing this test for our patients, right? So that's all. So it should be a hard surface where the patient can walk around, and we are calling this test as 6-minute walk test. So we'll ask our patient to walk for 6 minutes, right? So we require 100 feet hallway, and we do not require very advanced kind of equipments at all. The basic things we will be requiring over here, okay, and we can perform this test. So basically this test is actually measuring the distance. This test is actually measuring the distance that a patient can quickly walk on a flat hard surface, okay, on a flat hard surface in a period of 6 minutes, in a period of 6 minutes, as simple as that. Now it evaluates the global response of the system involved during the exercise. So basically we are having two very important vital systems which are involved in the exercises actively. That is, one is your pulmonary system and another one is your cardiovascular system, right? So basically we are testing for pulmonary and cardiovascular system very actively over here. And obviously when the person is actually walking, so using the muscles as well, so muscle metabolism can also be checked over here, but basically we want to check the cardiopulmonary status over here as far as this test is concerned, right? So the strongest indication for doing this test is to measure the response to the medical interventions you are doing in your patient. For example, you might be treating this patient for heart failure, you might be treating this patient for any sort of lung disease. It can be COPD, it can be ILD, or it can be any other disease as well. So it gives a good measure, of whatever intervention you are doing, whether the patient is improving with that or not. So very important indication. I will talk about the indications later as well, but the very strongest indication over here is that it measure the response. Very important, it measure the response to the medical interventions which you are doing. You are treating the patient for some cause, and if you want to know that whether this patient is improving to my treatment or not, you can perform this test, okay. So this is about this test. Now let's talk about, also it tells us about the morbidity and mortality status of the patient, especially in the ILD patients. It is very important because it tells us that what was the status of the patient. Let's say you are treating some patient, what was the status of the patient 3 months ago and what is the status now. Is the patient able to cover the same distance in 6 minutes as compared to before? So these are the questions which we need to ask ourselves, and we can take the help of this test as far as your medical intervention is concerned. This can be valid for the ILD patient, COPD patient, or any heart failure patient, or any other disease as well. So basically, more importantly, pulmonary and cardiovascular system are the ones which we can check over here, right? Now coming to the procedure, how to do it, okay. So I think this image would be better for us to understand how we are doing it. So it should be performed indoor only. So in your hospital, in your clinic, in your setup, we can very easily do this test. So this can be performed indoor along a long flat or straight corridor, which you can see over here, right? And the walking course should be 30 meter in length. For example, over here you can see two things. One is this one and another one is this one, right? In between this there should be a distance of around 30 meters, okay. In between this there should be a distance for around 30 meters, right? So that is the length, and the length of the corridor should be marked every 3 minutes, okay. Every 3 meters, I mean. So here it is the 30 meters, so every 3 meters it should be marked, so that we can measure that how much distance the patient is walking, right? And the turnaround point should be marked with a cone. For example, this cone could be the first cone and this cone could be the second cone. So these are the turnaround points. I mean, the patient will be, so here is the patient walking, right? So which you can see in the black color. Okay, I'm not able to mark over here. So that is the patient. Okay, so that patient will be walking between these two cones, right? So this is the patient. So the patient will be walking between these two cones, and then you will be measuring the distance in a period of 6 minutes, how much patient is walking. So in between these two cones will work as a turnaround point. In between these two cones, how much should be the distance? That is around 30 meters or 100 feet. Then every 3 meters there should be some marking, okay, so that we can know if the patient stops in between, how much distance the patient have covered, right? A starting line which is marking the beginning and the end of each lap, okay, should be marked on the floor using the brightly colored tape. Okay, so I mean to say that, so for example, this is the beginning point and this is the ending point. This should be marked with a brightened tape, so that we can see actually what is the beginning point and what is the ending point, right? So I mean, the distance between these two cones is 30 meters. So if the patient will be walking from this point, right, to this particular point and then coming back, so total it would be 60 meters, isn't it? So total distance it would be 60 meters for one turnaround point. So that we should know about, right? So how we need to prepare our patient? So till now we understood that it is an easy test, not a very high profile test. So how to prepare the patient? Very simple. So important part is the patient preparation. So we should be telling our patient that what we are going to do with him, right? So before the test starts, we should be checking some things. For example, is the patient comfortable or not? What about the clothing of the patient? So the whatever the person is wearing, it should be very comfortable, right? Appropriate shoes should be there for the walking, so that he is not having any kind of problem. The patient, whatever patient medications are there, whatever regular medications the patient is taking, he or she can take their he or she can take their medications at home on a regular basis. If the patient has eaten a light meal, that is acceptable for this test. Okay, so the patient should not have exercised very vigorously before 2 hours of this test, because that can differ the results of this particular test. Okay, so what we have talked about, I am just gonna write over here as well, so that we are not missing upon anything, right? I am just going to use a blue color over here. So I am talking about the preparation of the patient. So some important points we have talked about. First is clothing should be comfortable, isn't it? Clothing should be comfortable for the patient. Second point, whatever regular medications patient is taking, they can take it, no problem with that. Okay, regular medications, they should be taking it. Third point, the patient may have light meal, that is also fine for us, no problem with that. Okay, and fourth point, the patient should not have exercise. So no vigorous exercise before 2 hours of this procedure. Okay, these are some points which we need to keep in our mind. Okay, now we were talking about how to prepare the patient, right? So one more thing over here is that patient should be taking rest in a chair for at least 10 minutes. Before this test, ask your patient to sit and relax in a chair for 10 minutes before this test start. And meanwhile, what you need to do is, during this time, check for the contraindication for this patient, right? For example, did the patient eat just now before 30 minutes, or like that? What about the clothing of the patient, right? These kind of things we can check the vitals of the patient. In the vitals, what you need to check again, so check the vitals of the patient before starting of the test. Meanwhile, you are asking your patient to wait for 10 minutes in a chair or in a comfortable position, right? in the vitals, what you will check? So in the vitals, you should be checking the pulse of the patient, you should be checking the blood pressure of the patient, you should be checking the saturation of the patient by the pulse oximetry, right? And you should know the baseline dyspnea status. So what is the baseline saturation, what is the baseline activity of the patient at home? So this we should aware of, baseline dyspnea status. And we can also take the help of a dyspnea scale that is called as the Borg scale. I will show you. Okay, so we'll give this chart or scale to the patient and ask them to tick about their condition, right? So before the test also and after the test also. So then once we are asking the patient that okay, just relax, have a good rest, in that 10 minutes we check the vitals of the patient, instructing the patient what we are going to do, right? So once again, what we are instructing the patient, we will ask a patient that you need to walk from this particular cone to that particular cone, and the distance between these two cones is 30 meters. You have to start from this point to that point and then turn around and then coming back, turn around, coming back. So meanwhile, you will not be helping this patient, okay, you will not be helping this patient, or you will not encourage this patient to walk more and more in these 6 minutes. So the patient is having his or her own will, that patient can rest also in between. Okay, we should not encourage the patient to walk more and more in this particular test, that is very important. Okay, so he will be walking back and forth around the cones for 6 minutes. One more thing, in between these 6 minutes the patient can also sit and relax for some time and then again can restart this, I mean again can resume this test. Okay, but we should not forcing or we should not encouraging the patient to walk more while they are discomfort, while they are having discomfort, right? So once you understood this test, let's talk about some of the indications for this 6-minute walk test, isn't it? So indications, as I have talked about earlier as well, that about the pre-treatment and post-treatment comparison, medical intervention. So lung transplantation if any patient had, lung resection, lung volume reduction surgery, pulmonary rehab, COPD, pulmonary hypertension, heart failure. What about the functional status in the COPD, cystic fibrosis? You can just compare how these patients are doing before 6 months or after 6 months, like that. Heart failure, pulmonary vascular disease, fibromyalgia, older patients. So mainly the cardiopulmonary patients. Okay, this is very important test, right? And what about the predictor of morbidity and mortality? Sorry, actually this came over here. Okay, yeah. So predictor of morbidity and mortality, so heart failure, COPD. So basically the heart and the lungs disease are covered with this test. Okay, now coming to the contraindications, very very important for this test, and you should be explaining, asking the patient very cautiously that whether the patient had angina in the past 30 days. So unstable angina in past 30 days, this is the absolute contraindication and you should not do this, because obviously you are asking the patient to walk for 6 minutes. This can precipitate the angina if they had. So myocardial infarction in past 30 days, absolute contraindication. So unstable angina, myocardial infarction, this history is very important. Please ask your patient to do ask your patient that whether they had the hospital visit for the any heart condition. So that is also there. And then there could be some relative contraindications like resting heart rate. Before you are asking your patient to sit for 10 minutes and you are checking the heart rate or pulse, it is more than 120, relative contraindication. Systolic BP more than 180, maybe they have missed their hypertensive medications, that could be the cause. Systolic BP more than 180, again a relative contraindication. Diastolic BP more than 100, again a relative contraindication, because walking can further increase the BP. So these are the some of the contraindications which we need to keep in mind. Now, okay, we have asked the patient to rest for 10 minutes, instruct our patient how to do it, what he or she needs to do it in this test, what are the things we are checking. We have already talked about the vitals, and we were talking about the Borg dyspnea scale, right? So we need to give this to the patient and just hand it over to them and ask them about their dyspnea status. For example, if they do not have shortness of breath at all, so they will be marking it as 0, nothing at all. So extremely slight dyspnea is there, so they will be marking at 0.5, very slight 1, slight 2. So like that they can actually tick their status. And pre-test also and post-test also, we should ask our patient to tick box over here. So this is the Bog dyspnea scale. So that's how we can just compare the results of the pre and post status. Okay, so let's say the test is finished. Let's say the test is finished. So we are here. Let's say the person have completed the test. So what are the things we need to do post test, right? So firstly, we need to record that vitals of the patient. So very important, please measure the vitals of the patient. So we need to check the vitals of the patient pre test and post test. So again, BP, pulse oximeter saturation we need to measure, and we need to check for the Bog dyspnea scale. So once again, I am just repeating that: BP, pulse, saturation, and Bog dyspnea scale we need to give to the patient and ask them to tick about their dyspnea status, right, which we have just talked about. Record the number of laps, right, record the number of laps which they have completed from the counter. Okay, so one lap will be covering around 60 meters. So turn around, you know, I told you that the distance between one cone to the other was around 30 meters, right, was around 30 meters. So we need to take care about the lap, that what is this. So once that patient will be going from here and then coming back, that will complete the one lap, and one lap means 60 meters, isn't it? So we need to record the number of laps also after completing this test. Third thing which we need to check over here, record the additional distance which was covered in this particular test. So what is the time period which we are giving the patient? That is the 6 minutes. So whatever distance the patient is covering in these 6 minutes, we need to measure that. Total distance walked, whatever the patient had covered, we need to just get the idea of that, and to the nearest meter we will be figuring out that how much the patient has actually covered the distance, and we will be recording that. So record the distance in these 6 minutes, and getting the idea, rounding it off, how much meters the patient has actually covered. One more thing, interpreting this result very easy. Usually healthy patients or healthy persons, I will not tell the patient, healthy subjects or healthy persons, their 6-minute walk distance is usually 400 to 700 meters, right, 400 to 700 meters. An improvement of more than 70 meters walked is actually clinically important to the patient. For example, you had your patient, for example, it was COPD or it was ILD. Earlier this patient had a distance of around 300 meters, let's say, and now after 3 months the patient is having the distance of around 380 meters in this 6 minutes. So congratulations, your patient is doing fine, your patient is doing better actually, and your medical intervention, whatever you are giving, some sort of inhalers, nebulizers, or some sort of medications, they are working well in this patient, and the patient is actually improving to your medical intervention. So I hope you got a very good idea. So this test is not harmful at all, and you can perform this test at your home as well, considering that you are cautious about your elder friends, because you need to ask about a very important history, that is the angina and MI. Other than that, try it yourself and try to measure your distance in the 6-minute walk test. Thank you.